Welcome back to our education series on the heart, health and diving. We're in Chapter 5, Part 4, and now we're going to be talking about a condition called atrial fibrillation. Keep watching. Atrial fibrillation, or also called AF or AFib, is the most common type of arrhythmia and is characterized by a fast and irregular heartbeat. What I mean by that is that you really can't predict the pulse. It literally varies from beat to beat. The result, or the cause I should rather say, of atrial fibrillation is because of an uncoordinated contraction of the upper parts of the heart. And the disturbance in the electrical signals on their way to the ventricles is filtered out in such a way that there is an ongoing heartbeat, but because the signals are so chaotic, it is a variable rate in which the impulses go through, which is why ventricular pumping and action and contraction is therefore irregular. Now, atrial fibrillation is not entirely benign because it does decrease the overall cardiac output, typically by about 30%, which can affect an individual's capacity to exercise and of course also even lead to unconsciousness. In addition, AF causes blood to pool in the atria, which promotes the formation of blood clots. And blood clots in the heart, especially if they break loose, can enter the arterial system, and if that happens, it can result in a stroke. Recent studies in the United States have shown that there is a rising incidence of atrial fibrillation overall, as well as significant racial differences in its prevalence. The lifetime risk of atrial fibrillation at 80 years of age has recently been found to be 21% in white males and 17% in white women, whereas it's only 11% in African Americans of both genders. By 2050, it's estimated that it will affect between 5.6 and 12 million Americans. And these are significant figures because AF is associated with a 4 to 5-fold higher risk of ischemic stroke. Individuals with AF, after adjustment of other risk factors, also have a 2-fold higher risk of dementia or interference with cognitive abilities. The most common causes of atrial fibrillation are hypertension and coronary artery disease. Additional causes can include a history of valve disorders or hypertrophic cardiomyopathy, which is a fancy way of saying a thickening of the heart muscle, making it sick. And in certain cases, deep venous thrombosis and pulmonary embolism, obesity, and hyperthyroidism, which means an overactive thyroid, heavy alcohol consumption, and an imbalance in the electrolytes in the blood. Add to that cardiac surgery and cardiac failure. All of these may contribute to atrial fibrillation. Now, some people with AF experience no symptoms and are completely unaware of the condition until it's discovered during physical examination. Others experience symptoms such as palpitation, uncomfortable or irregular heartbeats, or sort of a flip-flopping sensation. Atrial fibrillation may fall into a variety of patterns, such as weakness, reduced ability to exercise, fatigue, lightheadedness, dizziness, confusion, shortness of breath, and chest pain. Now, occasional paroxysmal heartbeats are another type of arrhythmia in which there are symptoms that last only a few minutes or sometimes a few hours and then stop on their own. They may resemble atrial fibrillation, but because they are for a limited period of time, are called paroxysmal episodes. In other words, unpredictable and short-lived episodes. Such events may occur a couple of times a year, and the frequency may increase over time. If they're persistent, it means that the heart doesn't go back to its normal rhythm, certainly not on its own. Sometimes medication or an electrical shock is required to restore the normal heartbeat. If it's permanent, the heartbeat cannot be restored. Treatment may control the heart rate, but the medication may again cause additional considerations with diving safety, such as medication that's given to prevent the formation of blood clots or to try and control the cardiac arrhythmias. Now, any new case of atrial fibrillation should be properly investigated and the cause determined. The investigation will include a physical exam, an electrocardiogram, and measurements of the electrolyte levels, including magnesium, thyroid, a variety of other tests, sometimes an echocardiogram, and a chest X-ray. Treating the underlying cause of the atrial fibrillation may control the fibrillation. Now, various medications, including again beta blockers, may help to regulate the heart rate. But as mentioned before, this may impair exercise ability even further and would be a possible contraindication to further diving. Again, a discussion between the individual, their cardiologist, and a diving medical practitioner. Cardioversion, which is the electrical shock method of trying to get the heart back into a normal heartbeat, can be attempted, but it must be ensured that there isn't a clot already in the atrium, which could be dislodged by the electrical cardioversion. Cardiac ablation, which we've mentioned before, which is where with radio waves or microwaves a particular area of electrical conduction may be interrupted permanently, may resolve the condition, but that is not always the case. We've referred to this in the previous section on extrasystole, and we refer you back to that session. Sometimes anticoagulant drugs are prescribed, the most typical one being warfarin or Coumadin. The concern being that because blood pools in the atria, it may result in the production of a clot that may dislodge and end up in the brain circulation, causing a stroke. Not only is that in itself bad, but it may be confused with the symptoms of decompression sickness, and it may delay the treatment, rightly or wrongly, either compression or clot busting. So that's something again to keep in mind. Now, with all this being said, what is the potential effect on diving? Well, a thorough medical investigation should be conducted to identify the underlying cause of atrial fibrillation. It's often the underlying cause that is really the concern about fitness to dive. But even atrial fibrillation itself can significantly impact the cardiac output and therefore maximum exercise capacity. Individuals who experience recurrent symptomatic atrial fibrillation should refrain from further diving, and the medications that may be prescribed to treat atrial fibrillation may present their own problems, either by causing other arrhythmias or again by impairing the individual's exercise capacity. It is essential that anyone diagnosed with atrial fibrillation has a detailed discussion with a cardiologist before resuming diving. Thank you for watching this episode on the heart, health and diving, and specifically atrial fibrillation. Subscribe to this channel and remember to ask your questions. Thank you for watching.